take a close look at this smile, because what's happening right here in the mouth might be secretly jeopardizing the most vital organ in your body. Now shift your focus to this, the engine that keeps you going every second of every day. It's a startling question, but one we must ask. What if the pain you feel in a tooth is actually sending damaging signals straight to your heart? To understand this connection, we first need to identify the most common culprits lurking in your mouth, starting with gum disease. Gingivitis is the initial stage where gums become irritated. Yet, this mild condition can quickly progress if left unchecked. If gingivitis advances, it becomes periodontitis, a serious infection that begins to destroy the bone supporting your teeth. Beyond simple gum inflammation, deep-seated tooth infections, often harboring abscesses, present another significant root for trouble. Every time you brush or floss inadequately, or even chew aggressively, you risk creating tiny portals for oral invaders. These portals are the microscopic entry points, where the real journey from your mouth to your heart begins. Using clear visualization, we can see bacteria from diseased gums entering the tiny capillaries near the gum line. Once in the bloodstream, these microscopic pathogens are carried passively along the current, spreading throughout the entire circulatory system. The immune system mounts a defense, but this constant battle leads to widespread inflammation in the delicate lining of your arteries. This chronic inflammation directly contributes to the hardening and narrowing of the major arteries that supply your heart muscle. Furthermore, these bacteria can sometimes adhere to the internal surfaces of heart valves, potentially causing a serious infection known as endocarditis. The scientific connection solidifies when researchers observe elevated levels of specific oral bacteria in arterial plaques. This direct evidence suggests that poor oral hygiene significantly increases your overall lifetime risk for developing serious cardiovascular disease. Endocarditis, though rare, is a life-threatening condition where the infection causes damage to the heart's inner lining, requiring immediate medical attention. The plaque buildup we discussed, or atherosclerosis, is fundamentally accelerated by the chronic inflammatory response originating from the mouth. It is crucial to internalize this message. Your oral health is not isolated. It is an undeniable, integral part of your overall systemic health. Now, let's discuss the warning signs that your mouth is sending you. Signals you absolutely should not dismiss as minor annoyances. Persistent bleeding when brushing or flossing, even if slight, is a classic indicator that gingivitis is active and needs professional care. Furthermore, persistent bad breath, medically known as halitosis, can often be a byproduct of underlying bacterial buildup and decay. If you start noticing teeth feeling slightly loose or shifting in position, that's a major red flag indicating advanced bone loss underneath. Any chronic swelling, persistent tenderness, or unexplained pain in your gums suggests an ongoing inflammatory process demanding immediate attention. And finally, if you find yourself constantly battling acute tooth infections or needing repeated antibiotics, your mouth is clearly struggling. Fortunately, preventing this systemic cascade is achievable through a few simple yet non-negotiable daily habits we all must adopt. The absolute cornerstone remains brushing thoroughly for a full 2 minutes, twice every single day, ensuring you cover all surfaces. Brushing alone is insufficient, so you must commit to flossing daily to physically disrupt the bacteria hiding between your teeth. Don't forget that professional oversight is essential, so schedule and consistently keep those regular dental checkups and cleanings. What you put into your body affects your mouth just as much, so prioritizing a healthy, balanced diet supports strong gums and teeth. If you are a smoker, understanding that tobacco use severely impairs healing and significantly elevates gum disease, risk is vital for quitting. These small, consistent efforts create a fortress in your mouth, blocking the pathway that could otherwise lead to systemic issues. The final reward for this commitment is a vibrant, healthy smile that reflects a body thriving from the inside out. And that confidence is deeply intertwined with the quiet, steady rhythm of a well-protected heart. Ultimately, remember that proactively taking meticulous care of your teeth is a powerful, direct investment in safeguarding your heart's long-term well-being.